Thank you very much.
And you just listened to a young girl who was saying that the Nigerian community here is totally very angry. It covers all the aspects of various techniques of our development.
Was the Ijaw country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools. His major academic genesis was at the government college, Wajiri.
Go gather, destroy their food. With the camp and that other camp, don't go camp. You don't compensate everybody. But so
in its key generation sometimes. Today I'll focus on the style of teaching flag, a poet and writer, and we shall also be very interested in his point Akmo dancing.
Some lives are meaningful, some are empty. There are lives that are meaningful, with too much meaning and riches to offer humankind. You know, after some of these earthly adventures and no more, one can still find footprints of these great lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet. Welcome to Fighting Poverty and Engaging Conservation Through Sounds 2010. It is part of the Conference on Sustainable Strategies and Practices for Development 2010 as well.
I don't know how much has that been achieved. As of today, we are in 2010, and in the next 5 years, we'll be examining the MDGs to see what the world leaders have done in keeping their progress in the fight against HIV. I did a review with the MAP and the UNICEF in assessing universal access to treatment and care for HIV prevention in communities, how communities are involved in HIV prevention. And with that, it was noticed that Cameroon has the National HIV Strategic Plan. I think Dr. Invest or some of the people that work with HIV, they have the plan. And now let us look at how do we look at that plan? How do we translate that document, which is knowledge, into action? That is the challenge that we face. That's where we need a sectorial approach, which is we are using in development. How much have we achieved in using that approach? I will talk about some specific things. I will highlight some points because I know we have no time. Looking at the Tracking the Wheel. Tracking the Wheel is a project that I did. I was involved in South Africa and in Vietnam also. We were looking at the government spending policies, the government budget that is allocated in the fight against HIV and AIDS. If we understand that HIV and AIDS, or AIDS is a development program, it means it affects human, not about environment, it's about human. And the humans that make up the development, they are these same beings that are enhancing the development in the community. How much budget do we have for Cameroon that is allocated in the fight against HIV? How much budget is it that is allocated for the health domain? How much budget in the health domain is allocated in the fight against HIV? And if you look at HIV, we can divide the fight against HIV in three dimensions. We have the primary prevention, we have the secondary prevention, and treatment and care. Primary prevention is virtually the information prevention that we talk to people, sensitization. Secondary prevention comes as a result when primary prevention has failed. Then treatment comes as the third option. What are the strategies? How is the government? What is the approach? Who are the people that are involved in the fight against HIV? Is it politicians? Is it civil society? Is it the lawmakers? Who are the group? Who are the people that are involved? And what approach? Those are the unanswered questions that we should ask ourselves and re-examine if we are appropriate, if we are contributing in the fight against HIV in our own country. We understand that every contribution counts, for every contribution adds up to make a big difference. We understand that the fight against HIV involves everybody, and how do we approach it? This year, Cameroon passed the 12th round of the Global Funds for the fight against HIV, but the budget was far too reduced. Last year, we had $22 million for the fight against HIV for the Global Fund. This year, we have $8 million. $8 It means that our absorption capacity, we don't have much absorption capacity. We don't have prevention programs in Cameroon, so we don't need the money. Is that true? No. And that's the strategy. Who presents the strategy to the global funds? It's the government, it's the ministry. They said, because they don't even have they don't have programs, because they create the programs themselves to enrich their private pocket. Are those sustainable practices? Are we fighting against HIV or we're fighting for HIV? If you look at how they use the monies, they take the monies, they have girlfriends, things like that. How do they eat the monies? The monies are allocated to prevention, they still fuel the epidemic. They'll house girlfriends, take them to trips, give them whatever and things like that. Double standards. That's the same monies they're using to do prevention, that they're using to do other things. So those are the practices. It's a behavioral problem. We need to discard the behaviors as the environmental problems are discarded. We need to discard, our environmental minds are polluted. We need to start thinking about what sustainable practice we can incorporate. We have them, we know them, but we don't practice them. I'll also talk about the NGOs participation. How are local organizations participating in the fight against HIV? We see a lot of organizations we have, suitcase organizations, there are so many. We see organizations with no policy documents. We see organizations with no manual of procedures. It makes it difficult for funding because no development agent, no funding organization can fund you without having a manual of approach, a manual of procedure. You may not have a project, but they can propose a project, but you don't have a manual of procedure. How do they check? How are you accountable to your funders? Yes, it is true that we write good proposals, they are not funded. It's because we also do not understand the nitty-gritties in the fundings. I want us to accept this, that we need to reflect on this. Look at other organizations. One organization will have about 10 objectives. Fight against HIV, environmental eradication, name a few, right? It's so many. Be focused. Let's be focused. Get one thing, do it. Get your objective. Stay focused. In your little corner, you create an impact. It's just, we all know, I'm not starting to present a paper about this. I'm just talking about the attitude, the behaviors, the practice, but in another different approach, not in the cover that the doctor used, but I'm looking about in the managerial aspect of behaviors. So we want to propose another strategy that we think is more appropriate. It's a concept that we think if we incorporate this concept, we can help to reduce the spread of HIV. I run an international project called Dance for Life. I know not everybody, but some people in this hall know about the project. And Dance for Life is like using music and dance with young people to push back the spread of HIV. I know a lot of people will be asking how. If it is interesting, I should say, do I have much time? Okay. The Dance for Life is an international initiative that is established in 29 countries that uses music and dance as a strategy to push back the spread of HIV. What do we do with young people? We inspire them through our Heart Connection Tour. The Heart Connection Tour is a group of local artists made. They go to school, start on podium like this, inspire them with music, call them to come and interpret songs and things like that. We use that positive energy that they have to do something, to use their body to communicate, to push back the spread of HIV. They use their hands, they say, I can take responsibility. It's a choreography that will inspire them using their bodies and their sex organ to take responsibility to push back the spread of HIV. It's a new concept. So we inspire them through the Heart Connection Tour. We do the life skill program, which is the Educate, for a period of 6 months. Then we activate them. They do something in their community. And what these young people do is not much. It's something that does not entail finances or any finance. You may just like wake up in the morning. If you have a brother or sister or mother who is infected with HIV, you wash the dresses, no stigmatization, make up the sheets. I think that's enough. Give hope for that person to live one more time because the person understands that he has somebody who cares, who can support in that time of distress. Those are the simple activities. Or just going to the market and do grocery for people who are lying in the hospital or just walking in the hospital and tapping them. I mean, saying, it's okay, you'll be okay, take your medication, reminding them about taking their medication. It has an impact. It costs little or nothing. So we inspire these young people to take action to push back the spread of HIV in their local community. We understand that most people who are infected with HIV got the infection when they were teens, between the 13th and the 19th, if you look from doctor's presentation, right? And we understand that if we empower them, if we educate them, if we provide them with life-saving information and decision-making skills, they can push back the spread of HIV. That is correct. So we have these responsibilities as elders, as senior, as brothers and sisters, as elderly people for these young people, to empower them, to educate them about sex and sexuality, which, as from the presentation, they are more vulnerable to contract infection. Then we celebrate with them at the last end, that they celebrate their achievement, what they have done in their community to push back the spread of HIV. They do, we call organized concert, and we'll be organizing a concert on the 27th of November at Palais des Sports in Yaoundé with international celebrities like Zara, West Madiko, if possible, T-Pain, whom I've spoken with in the US, and they're saying that he should come for the concert. It's a charity concert where we'll mobilize these young people that are impacting community with the little activities that they have. We'll mobilize together to celebrate our achievements as agents for change. When you go through the 4 stages of the dance of life, we'll call you an agent for change. It means you are creating change in your community. And our agents for change are young people who are ages 13 and 19, who are in school. The dance for life is an in-school program, because it's difficult for us to assess and to follow up those who are out of school. It's not organized, but we think it's more appropriate if we work with in-school. But we're looking at other alternatives to see how we can incorporate in-school programs and organizing like street theaters, open public forums, and so on. And we also do this condom distributions. We will be starting, and we have 100,000 condoms or Durex for this year to distribute for free in communities. We'll go to nightclubs, we'll go to hotels, we'll provide them the condom for free. For free. Anybody who needs condoms, just tell me how you will distribute it, I will provide you the condom. Yes, they say a condom, one condom can save a life. Maybe at that time you are making a decision to have sex with no condom, you can be infected. But you have that condom that we can give you at that time when you want to make that decision. It can prevent you not only from contracting an infection, but also from impregnating somebody, or from getting pregnancy. So condom does not only prevent infections, but also unwanted pregnancies. So, brief. I'm not taking much time. Thank you.
Yes, let's hold on for questions.
Thank you for your very excellent presentation. About condom distribution for free, I have a lot of question marks over that. And I think, for me, I think that the best way is to sell the condoms, maybe when it's 10 francs. But when someone is doing 10 francs in the pocket to buy a condom, he knows why he's buying it. And I mean, it shows some concern, some knowledge of its use. And it will also be good if you have a sales point, or you want to sell a distribution point. And it should be like some kind of research. You should try to monitor, the sales or the distribution and the usage of the condom, because you give condoms to people for free, they can take that one, lock the thing up in the house there, they don't use it, and you might say that, oh, this community is really using condom. Whereas in actual fact, they are just dumping the thing in their houses.
Thank you, Doctor. Thank you. Thank you.
There's another question.
Thank you so much, Wajiri, for such an excellent presentation. And I also want to thank you particularly for the fight you are doing in order to give people, first of all, the infected, give them courage that they are still human beings, so that they don't suffer from stigmatization. My worry is I want to ask that since most of the patients who are infected, you see the activities get reduced because the immune systems are affected. What the strategies do you really propose in terms of skills training, skills which can really help those whose energies but they are still very useful in the society? Thank you so much.
For the next question, I think looking at using the multi-sectorial approach in the fight against HIV, there are a lot of activities that they are organizing to sustain people that are infected with HIV. Vis-a-vis the multi-sectorial approach, working with other organizations that are working on sustainable development. For example, if I understand that you are doing something on apiculture, and I understand that you have the mastery on that apiculture, and I know somebody who is HIV positive or who has full-blown AIDS, and think that we can give him that skill to do something on apiculture, I can relate that person to you for you to provide the skills since we are collaborating based on the MOU that we may establish to ensure that you provide that person with that skill that is appropriate so that the person can continue with the activity of apiculture, making more, producing more of the honeys and things like that to sell and to get some resources, some monies to sustain his or her life. I think that is just about networking, partnerships, and using the multi-sectorial approach, and also lobbying for finances from the government, from other development partners that are supporting people who are living with HIV with microfinance grants. Thank you.
One interesting highlight at the Conference on Sustainable Strategies and Practices for Development and Fighting Poverty and Engaging Conservation Through Sounds was the contributions of the head of PEP program for Cameroon, Melvine Wajiri, and he actually talked on issues related to how his organization had engaged in the dissemination of knowledge about HIV prevention, and also how they have actively recruited young Cameroonians to participate in the process. So we thought it was relevant because the youths constitute a major factor of our workforce and also an important aspect of the population, and they are necessary in shaping the long-term development goals and strategies for Cameroon. And if they are healthy, then it is for clear that they will be more useful to the design of a long-term solution to the poverty, to the economic disparities in Cameroon, and to the widening gaps between the rich and the poor, and also to stagnation that is affecting the country and the region as a whole. And this has been Arrey Ivo for the African Center for Community and Development. I have been reporting on the Conference on Sustainable Strategies and Practices for Development and on the workshop Fighting Poverty and Engaging Conservation Through Sounds 2010.
Sometimes. Today our focus will be in the style of J.P. Clark, a poet and writer, and we shall also be very interested in his poem Akmo Dancer.
It's something that needs to be exploited. Some lives are meaningful. Some are empty. Lives that are meaningful with too much meaning and riches to offer humankind. You know, after some of these earthly adventures and more, one can still find footprints of these great lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet.